Well, I appreciate you spending some time with us today on the Transplant Helper podcast. My name is Jim Merle, and as I remind you once again, this week I'm not a medical doctor. I work nowhere in the medical field, and so take every ounce of advice I give you today as only that, just the advice of a former and a fellow transplant patient. I understand your needs, I understand your wants and your desires in learning more about transplant, and so that's all I'm trying to offer you here today. We're going to be talking today about medication management, and without a doubt, it is the most important subject that is needful for every transplant patient. It makes no difference whether you're a heart, a lung, a kidney, a liver, a pancreas, or whatever kind of transplant it may be, or a combination of those. You're going to have to, at some point in your walk as a transplant patient, learn to manage your medications and to manage them well. As I say concerning our medicines, you've got to be able to take those medications on time, every time, and accurately, or you're not going to survive or have any kind of quality of life. Your danger as a transplant patient of going in rejection is increased hundreds of fold if you miss even a few dosage or go without your medicine as little as 24 to 48 hours. And so you can see, because of that, it's very, very important and even vital that you take your medications as prescribed by those doctors, nurses, and coordinators, and to be sure that you know what you're doing as you do that. So let me go over some methods with you. Particularly my method is where we're going to get, but let me go over some methods with you and teach you some things about transplant medications that you're going to need to know. We're going to cover this not only in today's episode, but in others also, by the way. But I want you to realize when you first come out of surgery after transplant, they're not going to immediately just go and throw these 1,600 some odd pills in your lap and say, have at it. They're going to be some kind of a training program that's put in place by your hospital and your facility, primarily headed up by a local pharmaceutical that works alongside of your coordinators and your transplant team. As a matter of fact, they're going to be a part of your transplant team that are going to assist you in learning your medication. They're probably going to come to you with some sort of chart, such as the one I'm about to show on the screen, and that chart in itself is going to look similar to this. It may even have, like this chart does, a picture of the medication, which is handy. It'll then list the name of the medication or the variants of it. It'll then list the dosages that you need, how many milligrams or whatever the dosage is. It'll then list the times of day that it can be or should be taken, and then turn and list the possible usage or the reasoning behind why you're taking this medication. You say, well, why is that important? Well, first of all, the visualization there, the picture on there is very important, because when you take those bottles at home and you look at them, you need to be able to visualize and say, okay, this medication is a certain medication because I can see it with my eyes. For example, I take one medication I'll use time and time again as an example. It's called daltalzine. You say, well, I don't know what that is. Doesn't matter yet. Daltalzine, for me, by its manufacturer, is a blue and green pill. It happens to be, and the chart would match this for me, a 180 milligram pill. It's taken both in the morning and the evening, and it's typically used as a blood pressure medication, but for transplant patients, particularly the heart transplant patients like I am, it's used to help keep Prograf, yet another transplant medication, in our bloodstream. Now, if you know that, you're going to be way ahead of the game in understanding your medication management, you see. And so when they give you that initial chart, that chart is going to be extremely important into your beginning to learn those medications, beginning to understand those medications for yourself. Now, your caregivers, your spouse, your children, whomever it is going to be spending time with you at home and after transplant, those people need to know these things too, but you need to be the student. You need to be the one that's trying to learn these medications far and beyond and above all of that. Now, let me give you some suggestions that you need to have in your hip pocket, if you will, to go along with that. Besides that, you need to have some other tools at your disposal or at hand to help you manage your medication also, such as, let me suggest that you get you some sort of an app, whether it be on your phone or just by the way of a computer, looking up on your Mac or your PC. Find some sort of an application that is a pill finder. That is, it identifies pills where you can take a pill out of a bottle straight from the pharmacy Pop the top, pull out the pill, look at it, and maybe such as the one I'm going to suggest does, it asks you, what's the shape of it? What's the color of it? Are there any marks on it? Any engraved marks? Are there letters or numbers? And you punch in all this information, and then it in turn, when you hit go, spits back out exactly what that medication is and a lengthy description of usage and side effects and everything that you need to know about the medication. You say, why is that important? Because pharmacists sometimes make mistakes. There are times when you'll go to the pharmacy and you'll order a certain medication. I'll use my Ditalzim, for example, again. You'll go to the pharmacist to pick up your Ditalzim. They'll hand you a bottle. It'll say right on the outside, Ditalzim for James Merle, 180 milligrams, and all of this, such and such, take twice a day, morning and evening, yada, yada. And then you'll open that bottle and you'll say, that pill doesn't look right. That pill doesn't look like the one I normally take. That pill's not blue and green. That pill is orange and purple. Well, that's when you need to take out this app on your phone or go to your PC or your Mac or whatever, and you need to look up that medication and make sure that what they've given you is Ditalzim. You don't take any of those, not one, until you are certain that that's what you have. Now, maybe they've just changed manufacturers. Maybe there's just a different batch, whatever. Pills do change. Colors, identifiers do change, but that pill finder is going to help you to know that. Now, one that I suggest here that can be found both and used on the PC. It can be used on the iPhone, on Android phones, all three. It's called iPharmacy Pill ID. Now, it's made by medconnections.com. So you can go to medconnections.com and you can get the links to get the iOS app for the Apple or the Android app from Google Play Store for iPharmacy Pill ID. That is one of the best apps out there as far as this goes. It'll also give you certain other things that I don't necessarily use that are schedulers and different things that you can use to enter in your medications when you take them. It'll give you reminders and such. That's great tools. I mainly use it to look up the tools as a pill finder. So iPharmacy Pill ID from medconnections.com. That's a great thing. If you need a schedule for reminding you to take your medications, let me suggest, though, that you use MyMedSchedule.com. That's MyMedSchedule.com. Again, apps are available for Android and iOS devices also, as well as on the PC and the Mac. You can reach that via the internet. Those things are great. Now, there are several different ways they're going to teach you to take your medications. First of all, they're going to give you the chart at the hospital. Here's your medications. Here's the time of days. Here's the dosage. And they're going to give you check boxes. Morning dose, midday dose, evening dose, whatever. Check here, check here, check here, check here. You need to do that. Do that. That's very important. That's how you're going to learn your medication. But they're also going to suggest to you something I reject. They're going to suggest to you that you take a time of the week, maybe on a Sunday afternoon or Monday morning, whenever time is free for you, and sit down and lay out all your medications for the week. They may even give you a big old pill box. And I've got a pill box that I don't use that I think has 42 slots. It's got like 6 slots times 7 slots, whatever it is, that they're going to hand you and say, here, take this and lay out all your medication for the week in this pill box. Put it all in there on a Monday or Sunday or whatever it is, and then all week long, all you got to do is look and say, well, here's Monday AM medications. Open the little slot, pop it in your mouth, drink your water, go on your day. No, don't do that. Here's why. If you're sitting down to do your medication, say on that Sunday, we'll use Sunday for example, and you make a mistake on Sunday that you repeat for all of those dosages all week, 42 times, you're going to take your medication wrong if you make a mistake. If you reach and grab Ditalzim in place of, for example, in my case, Myfortic, which is not hard to do, but if you grab Ditalzim in place of Myfortic and you put that in those bins all week long in the wrong place, you're going to die. By the end of the week, you're going to be in full-blown R3 rejection and you're probably going to die. I suggest you do not use a pill box. Now, if you need to go on an overnight trip, yeah, get your medication together, go on the trip, come back. But I suggest a method, and I'm about to show you. I'm going to take you over to the other side of the room and show you the method that you can use that will help you to bring your medication together in a more accurate way to avoid mistakes. Not only mistakes in your home and mistakes on your side, but mistakes at the pharmacy. Because if the pharmacist made a mistake and you dole out those pills for the week, you're going to repeat that mistake over and over and over, and you're not going to catch it because you sat down in one moment and you missed it and you repeated that missed mistake all week long. Don't do that. Don't do that. It's bad. Let me take you to the other side of the room. I'll show you what I'm talking about and we'll come right back. Well, as I said, the method that I use to put my medications together, those 3 times a day that I take them at 9 a.m., 3 p.m., and 9 p.m., is the same every time. And that's really that I just have all my medications in one place, which in this case is in this clear plastic bowl. I don't actually keep them here. I keep them normally in a big nylon bag that's much larger than this. They wouldn't fit all here anyway. But I basically keep them all in one location. And as I go in to get them, I don't really have any care about what medications I get out first because I memorized the medications and how many I take of each of those medications. And so I'm just going in to pull out each of them and put them into some sort of other container, which in this case, I just typically use one of the lids off of the medicine bottles. I think it always holds my meds, at least for the morning or evening doses for that matter. And I'll just take and lay that to the side and I'll go in. I won't go in specifically to get out anything. I'll just grab whatever I get. In this case, I've got my tacrolimus, which is also known as Prograf. I know that out of these 1 milligram tablets, I take one of these in the morning. And so I'll go ahead and grab one of those and put it over here in this little container off to the side. And that's my dose. Now, the key to all of this is as soon as you take that, don't throw it back in the bucket because that could easily confuse you as to whether or not you've pulled this medication out or not, because if you've got a good pile of medications in here, you may not be able to necessarily see everything that you have by the time you finish this. And so I will take that as soon as I take this Prograf in this case out, I'm going to put it over to the side and get it out of the bucket because I want to see this bucket wearing its way down as I go in. So I'll just reach in and grab the next type of medication. This happens to be Valsite. I'm not on Valsite anymore, but I keep some of this around because it's a very expensive medication, and there are times post-transplant when the doctors are going to take you off, and then they're going to turn around and say, hey, you need to get back on this for a period of time. Don't throw away your old meds until they're expired, because this here cost me about $1,300. So you don't throw that away. You hang on to it. But I'm not on it now. So I'm not going to ignore it. I'm just going to pull it out, make sure that's what it is visually and also by label, and then put it over to the side. It's as easy as that. I'll go back into the bucket, grab the next one. This happens to be my calcium carbonate. I only take one of those a day. It's 1,250 milligrams. Of course, as transplant patients, we lose a lot of calcium and such out of our bloodstream because of some of these other meds, and so we need that for bone density and overall bone health and also immune health. And so I'll just take that, put it over here into this lid, and again, third process, put it over to the side. I want to continue to get that out of the container so I can see what I've eliminated, what's already been put out, whether I used it or not. I'm going to get it out of there. Now I grab my microphenolate, also known as Myfortic. And in this case, these particular tablets, I take 3 of these at my 9 a.m. doses. So I'm going to go ahead and grab my 3, which you'll get used to doling these out pretty good. Drop them off into my lid laying here and throw it off to the side. Now just continue to keep up with this process. Here's some iron tablets I don't have to take anymore. Again, I hold on to them. They're not very expensive, but why throw them away? They're still inside of their expiration date. Mag oxide. I have a problem keeping magnesium in my bloodstream. You may be different. Just one of the supplements I have to take. I take 3 of these 3 times a day, but since this is considered my 9 a.m. dosage, I put that right there and then cast it over to the side. We're wearing ourselves down. Daltalzine, it's a blood pressure medication. Typically, most people take it for that. Heart and lung transplant patients sometimes take it because it helps to keep Prograf in our bloodstreams, and so that's very important. And so we take Daltalzine, helps with the blood pressure and to maintain those Prograf levels. So I take one of those 180 milligram tablets in the morning, and there it is, cast it aside. reach back in. Here's yet another medication for me. It's Topramate or Topramax, whichever one you want to call it, whether it be brand name or generic. This is for migraine headaches, and not everyone takes that, obviously. I happen to take one of these every morning of my life, so I'm just going to take and dole that out, put it right here, put the lid on, and throw it aside. Grab one out, the last one right here, prednisone. It's a steroid. All transplant patients will probably take it at some point, some for only a few months, some for a few years, and some for the rest of their lives. I'm down to the very end of this. I'm going to be taking this for about 2.5 milligrams for another couple of months, and then I'll be off. And so I grab a half of one of these tablets. I keep some of them already cut, so I'll go ahead and find my half tablet and take and put it here to the side and throw it out. Now, here's what I've got. Look right here. The container's empty. If the container's empty, I know already I've gone through all my medications and at least laid eyes on them and at least evaluated whether or not I needed them. So I see here that it's empty. I've been through all my medications, and now I'm going to turn and take my lid or whatever I'm housing these in. I'm going to look at it, and I'm going to visually decide, okay, does this look like what I typically take? In this case, it does. But say it didn't. Let's say I look here and I say, well, I see everything, but I don't see a Prograf. How did I miss Prograf? Well, I shouldn't have missed it, but I'm going to go back through as I'm taking these medications now and putting them back into the container. I'll just begin tossing them in, and I'm going to look, and if I come across Prograf now, I'll double check to see if I have it here. If I don't, if I still don't have it, then I'll go ahead and grab me one of the Prograf tablets out and add it. If for some reason, as I'm reloading this bucket, I don't come across Prograf, then guess what's happened? Either I've lost my Prograf, or for some reason, I've ran out. And so I've got to get that order. I've got to get that back into my bloodstream very quickly, and that's a really important medication we'll talk about on another episode. But I'm just gradually grabbing all this, putting it back in. Of course, I'm reloaded. Everything's ready to seal off the container. In my case, zip up the nylon bag and put it away. Why does this method work well for me? Well, there are many reasons for that, but number one, it works well for me because everything's together. Number two, as I go through and go through each of these medications bottle by bottle, I'm learning what these pills look like, what the dosages are. I'm being reminded constantly what I'm supposed to be taking. So I'm not going to be making mistakes from the pharmacy. They give me a bottle of pills that is supposed to be Prograf, for example, and it's not. And so I'm taking a pill that says Prograf right here, but it's actually not Prograf. I'm not going to make those mistakes as often because I'm going to know what my pills look like. I'm going to know what they're supposed to look like. And if you ever get anything from the pharmacist that doesn't look like it should, ask them. But then I would also take one of those pills at some point, pull it out of that container, and open up one of these pill finder apps or get on your computers, whatever you can, and check those pills. See what they are. Look at the color, look at the type, look at the little codes and numbers. Make sure that that comes up matching what it's supposed to be. But by doing it this way, I've got 3 separate times every day to be sure my medications are right. So I'm not going to be making a mistake in a pill box for an entire week because I'm going to be doing this individually. So I'm learning the medications over and over. I've also got 3 opportunities every day, in my case, to be certain that I'm not running out. In this case, this Thaltazine, I've only got a few left inside of this bottle here, see? And so I know, okay, that's not going to last me through the week, so I might want to go ahead and order that. Well, suppose I do that at 9, and I say, I'm going to order that. I'm going to order that as soon as the pharmacy opens, and I forget. Guess what? At 3 p.m. and at 9 p.m., I've got a second and third chance in one day to do this. If I've done out my pills for the whole week, I may not have that second and third chance until I sit down to do that another week, and I've let it slip my mind, and I'm in trouble. So this is just a basic, very simple, obviously very simple way to keep up with your medications. There are many benefits to it, many of which I'm not naming for you right now, but to me, it far outweighs the checklist, which you'll need that checklist in the beginning. You'll need a checklist to look at and say, okay, here is my tacrolimus. I take 5 milligrams. I take it twice a day. And here's what it's used for. It's used to prevent rejection, that sort of thing. You're going to need that in the beginning. But once you begin to get familiar with these pills, You need to be sitting down with these pills on every chance you can and setting these medications up and putting them aside just like this to be sure that you're getting everything you need, okay? Again, empty bucket, your pills are there. Something left in the bucket, look again. That's all you have to do. Now, if you're a person who has to go off to a job every day or something like that, I understand that. You say, well, I have to take medications at noon and I'm at work at noon. Then do the same thing. Sit down in the morning, get your morning dosage ready, get your noon dosage ready. But don't try to get the night dosage ready if you can help it, because you need that second chance. You need to be coming back to this. Again, this is just my method. I'm just sharing it with you for suggestion, and I appreciate you spending time. Thank you. Well, again, I appreciate you spending this time with us today on this Transplant Helper podcast / YouTube video series. I don't feel like we discussed this subject adequately at all, so we're going to be coming back to it on several more occasions, looking at it from different aspects, different perspectives over time. But I do hope that the way that we presented to dole out or distribute your medication for a day's dosage is going to help you a little bit, help you to avoid primarily mistakes, keeping you from putting yourself into danger by making simple mistakes that could cause you great harm. And so hopefully this has been able to help you in some way. If it has or has not, please like us or don't like us. Subscribe to this channel, to this particular YouTube series, whatever you can. Share it with those who need it. This is particularly made for transplant patients, obviously. So whether you're heart, lung, liver, kidney, pancreas, whatever sort of transplant it is, help those people to find this out by letting them know about it. You're soon to have a friend or loved one or even yourself who may need this. And so I appreciate you watching the videos, and check back on next time as we discuss yet another subject. Thank you.